even if we have perfect knowledge about the relationship between diet and nutrition and cancer, there's still the question of how do we put into practice what we've learned scientifically? What's the connection between scientific knowledge and really cancer prevention? And in this area, almost everyone has a role to play. We've looked at this from a broad perspective and have identified a handful of different areas that need to be involved if we're going to most effectively translate information about diet, physical activity into cancer prevention. First of all, schools are a very important place where we can improve nutrition. I think everyone is aware that school lunches and foods in schools in other contexts have often been very far from optimal. In a lot of places, progress is being made. Sugar-sweetened beverages are almost entirely out of schools now. There are some important steps that have been made already, but there's a lot more work to do. Healthcare facilities are another important place where we can do a lot more in terms of cancer prevention by diet. It's sad to say that if we look at many hospitals, including many of those in our own area, that the food served both to patients and food services for employees are very far from optimal. Often sugary sweetened beverages are widely promoted and available. Often whole grain foods are not in abundance, and there's a heavy emphasis on desserts and fewer vegetable protein options than we would hope to see in a health promoting environment. So a lot can be done right in the very places where many of us work.
The big bumper sticker conclusion for recommendations now are first to maintain a healthy weight, which means not getting overweight, and if you're overweight, eat an low energy diet in order to lose weight and also increase in physical activity. And also eat a dietary pattern that it's sometimes described as plant-based, but to demystify that, it means eating a lot of fruits and vegetables, choosing whole grains, replacing meat with other non-animal sources of protein like nuts and legumes. And that dietary pattern is one that not only will reduce risk for cancer, it may increase the likelihood of survival after developing cancer, and then finally may reduce the risk of other chronic diseases that will be a cause of death if cancer is not. Diet in cancer is most critical as people get older. Cancer in many ways is a disease of aging. And our population, due to the baby boomers, is increasingly older. And so we don't see any decline in the incidence of cancer. The cancer cases are going to continue to increase throughout the next few decades. And it's also a concern that in younger people, because obesity is so common now among children and teenagers, they're likely to stay overweight as they get older. And being overweight increases the risk for cancer. It increases the likelihood of dying of cancer. And so, unfortunately, we don't anticipate that we'll have fewer cancer cases over the next few decades. So it's even more critical to communicate this public health message that despite any genetic tendency or despite aging, that a dietary pattern may actually prevent that.
One caveat that we need to keep in mind is that almost all the studies of diet and cancer up until this point in time started off with the participants in midlife or later. And it's very possible for breast cancer and maybe some other cancers that diets during childhood or during adolescence are what's really important for breast cancer risk or risk of other cancers later in life. We're just starting to get some data at this time on diets during the high school years and breast cancer risk decades later, and we are seeing some findings that are different from the studies when we started off looking at midlife and later. The whole media area does need attention as well. Unfortunately, children receive a vast amount of information on what we should eat. The Kaiser Family Foundation has documented that children see about 5,000 ads promoting food or beverages per year, and in their survey, not a single instance of those 5,000 episodes included encouragement to consume fruits or vegetables. It's heavily weighted toward unhealthy junk foods. that we really have to have better control over the media to make sure that healthy foods are promoted and not exploit children just for to be consumers of junk food. Physical environment is also an important place where work needs to be done to make physical activity an easier, convenient option and safe, both from physical collisions or crime. Is very important in promoting physical activity, to have safe places to walk, to ride bicycles, to access public transportation. The whole food environment is very influential. The fact that low-income people often eat diets that are very unhealthy, bad for cancer prevention, is an area where we need a lot of attention, that often healthier food options are not available, or if they are, they're often not fresh, often expensive, and so making food available to everyone at an affordable and cost is a high priority. Some of our analyses of dietary trends in the United States have been encouraging in one way, that we have seen steady improvement in the quality of diet over the last 12 years. The discouraging part of this is that virtually all the improvement has been in people with higher incomes and more education, and that there's been almost no improvement in people with low incomes and low education. So this gap between upper SES and lower SES has about doubled over the past 12 years. So it looks like an encouraging trend on average, but clearly from a public health standpoint, there's a lot of work that needs to be done, not just bringing up the average, but controlling the gaps. The optimistic picture of all of this is, of course, that by modifiable means, not smoking, regular physical activity, and healthy diets, we should be able to prevent at least half of cancers that are currently happening today.